My name is Steve LaSalle. I'm an assistant director with Louisiana Probation and Parole, and we're starting our community corrections virtual roundtable number 4, probation officers on the front lines against COVID-19. We're going to wait just one more moment, let a few folks pour in as we get ready. As we do that, I'll just say a personal word that as we start this broadcast, we have many of our staff statewide who are feeling the effects of Hurricane Laura. I know of already one officer who has lost his home. So I do ask for your thoughts and prayers on our staff as they're working special operations, as they're trying to take care of their families in their homes. And it's pretty much statewide that people are being affected. So we do really appreciate your thoughts and prayers at this time for our staff and for our state. So in saying that, just like this storm doesn't affect just one community, COVID-19 has not just affected just one community, one city or state or country even. It has been a global pandemic that has affected us all on multiple levels. It has certainly affected our family, the community corrections family, globally. And so we actually have a video from a gentleman in Poland from our community corrections that we're going to play for you folks and give you a chance to see how has it affected folks outside of
Good morning, friends. My name is Romuald Burczyk. I am the president of the board of Polish American Development Council Foundation and co-founder Probation Officers Academy in Poland. The pandemic changed a lot in functioning probation teams. On March 12, many restrictions were introduced in Poland. All field activities in the courts have been completely suspended. There were exceptions, such as, for example, the need to conduct interviews in family matters or the executions of the decisions to remove a minor child from parental authority. These activities mentioned were carried out with implementation of sanitary procedures. Since June, all that activities, step by step, are coming to normal. During the most severe restrictions in March, April and May, probation officers did not perform field work, except serious cases. Interviews about the situation of probationers in the local community have been cancelled. However, the court introduced safety procedures in cases where it decided that they were necessary. Probation officers were special visors, capes, protective gloves, and disinfectants. The probation officers decided to talk with probationers and other people outside the buildings and at a certain distance. Many cases were suspended, but not for the highest risk people under probation. In the period from March to May, all cases under supervision was performed remotely. During this period, in many courts, probation officer needs to perform field activities related to the start of new cases. It took place when he had confirmation that the supervised person used violence against family members. In many cases, probation officers conducted telephone conversations with supervised person and used an email to send documents. The supervised person sent medical certificates and other documents via email. Of course, telephone contact does not provide full information about the situation of probationers. Therefore, probation officers additionally intensified their contacts with social agencies. For example, social workers, family assistant, policemen, school staff. Good partnership between probation teams and many institutions developed over many years has paid off in this difficult time. In the period from March to May, persons under supervision were not allowed to come to court. Since June, in many courts in Poland, supervised persons may enter the court building only on a special permit. Court administration prepared separate room where probationer or their family member and other person can meet with probation officer. Currently, it is not possible for supervised persons to enter the probation office as before. Also, protective barriers have been installed in the room. After the supervised person leaves the court, the court staff disinfects the room in order to prepare it for a meeting with next person. No community service was performed since March. Also, community service has been suspended. New penalties in this matter were not issued because the courts were closed from 3 months. Community service has been performed again since June. In family matters, the full scope of field activities related to supervision in matters of care for minors. Other cases can be performed remotely. All probation teams in Poland usually work in the courts. Usually about half of the team is in the office and the rest of team do the field work. However, currently only one team member is present in the office and the rest of the team work remotely. This practice is used in many courts in Poland. I believe that it is possible for the judiciary to function efficiently at this difficult time. I hope that the current difficulties will end soon. Stay healthy and safe. Best regards from Poland. God bless Poland. God bless United States.
Okay, folks, we're back. We have today two special guests from the front lines of community corrections, and I'm going to give them an opportunity to introduce themselves. Alicia, we'll start with you. Please introduce yourself. Tell us how many years you've been in community corrections and what your position is.
Hello, everyone. My name is Alicia Hitt, and I work for Harris County Juvenile Probation Department in Houston, Texas. I've been with the department for 6 years now, and I am currently working as a school-based juvenile probation officer for Westside High School in Houston Independent School District.
Thank you. And Veronica?
I'm Veronica Glick, and I was the probation officer up until the end of July for Westchester County in New York. And I was supervising the mental health program, the probationers and mental health.
Great. Okay, folks, just want to let you know we do have a chat forum that you can join over on the right side of the screen. Also, we've posted a poll. We'd love to hear some information from you folks, as well as there's a question and answer. And at this time, if you have any questions for any of us, or particularly Alicia and Veronica, ask that you would post a question there. If it's geared toward one of the guests specifically, then if you could put their name as well so we know who to direct the question to, that would be great. So Alicia, tell us a little bit more about your exact role in your agency. You mentioned that you worked with schools. What does that look like?
So it is a new program. We piloted it starting fall 2019. It's a collaborative effort with Harris County's Juvenile Probation Department, as well as the largest school district here in Harris County, Houston Independent School District. Several officers were selected to go into the schools as school-based officers, and I was one of them. I've been placed at Westside High School, as I stated. And what that looks like is primarily just enhancing the support and advocacy of our probationers while in school. I report to my actual school 4 days a week, literally 4 days a week. So I'm there all day long from the start of school to the end. And while there, I pretty much just participate in anything pertaining to my youth, from special educational need meetings, the art meetings, 504 plan meetings, behavioral meetings, creating behavioral intervention plans with their deans and their assistant principals, sitting on panels for behavioral reviews. Anything that pertains to my youth, I am incorporated in that discussion. I am sitting at the table to help navigate us through what's the best course of action so that our youth can be successful in the public school setting.
Wow, that sounds great. So the big question I would start off with you is, since the kids are not in school right now due to the COVID, how does this affect your work right off the bat?
Yeah, it was a big adjustment for myself, the school, and the youth that I work with. We really had gotten accustomed to seeing each other every day, and having that access. That has definitely been removed with schools closing. However, I still partake in all meetings, all disciplinary hearings, all schedule planning for my youth via like Microsoft Teams, Zoom meetings with administration at the school. We're still doing everything we would do with the youth face to face, but now we're just utilizing all the technology out here available to us to incorporate the parents as well as the youth into those discussions that we would have had face to face. Sometimes it's a little challenging if the families encounter communication breakdowns, meaning they don't have those resources, they don't have access to the Zoom, they don't have the laptops or the cellular devices which would allow that communication. But in most cases, our students do have it, and the school district has been very good at issuing out laptops to all the students as well as hotspots.
That's great. That's great. We'll get more in depth in that in just a moment. So Veronica, if you could tell us about your agency and what is your role at the agency and some of the types of cases that you're dealing with.
So when I was working at the probation department in Westchester County, I was supervising the mental health population, and that required us to make sure they engaged with mental health treatment. Sometimes they were in the mental health specialized court. Through that, we worked very closely with the Department of Community Mental Health in Westchester County to make sure they got all the available services, as well as all the other agencies in the county that provided mental health and family services to these individuals. Many of the mental many of the population in general, but also in mental health, they self-medicate with medications. So a lot of my individuals I was supervising were methadone maintenance for opioid dependency. So that was very important during this whole time to make sure that they were able to maintain that as well.
Excellent. So I'll lead off with the same question I asked Alicia. So especially with the mental health patients in cases, that is already very taxing and very tricky caseloads to handle. So how did the onset of COVID-19 affect that work for you guys?
Well, it was very abrupt because, COVID here in New York, we had one case and then we had a cluster. So things kind of abruptly shut down. We were placed on a New York pause order on March 20th. So imagine, I'm sure you've heard the news about COVID creating a mental health crisis for normal people, but imagine what it does to the mental health population who already struggle with supports and having contact with others, or lacking support and lacking contact with others. And now you're asking them to limit that contact with other people from their programming, from their group setting, from their peer supports. So some of it was very difficult for them, and also very anxiety ridden to change their schedules, because a lot of them need very distinct scheduling and to keep them locked at home. I mean, could you imagine somebody who's like schizophrenic and also hears audible delusions, not being able to go talk to somebody about it, and they're just sitting at home? And then you're talking to them. We had to be careful too with treatment with some of them, because, to have them participate in Zoom or audio treatment over the phone might have altered or heightened their audio delusions. So that was something we had to be very cognizant of with our treatment providers, and also with us speaking to them and working with them for that specific population that experienced those symptoms. So
as it went on, did you folks see an uptick or a rise in whatever, I'm not sure what you would call it, but having to take those folks back into custody or placement in a home or things due to the situation going on? Or has the population been able to adapt to some degree as well and is doing pretty good with this situation?
I think some people who have mental illness and are educated about their illness and their symptoms are very resilient, adaptable to things. Some of them are new to the whole treatment process. So it was very, like I said, anxiety ridden for them. And then, having to be in homes with people who might not support their mental illness or their recovery could be difficult for them. A couple of my people would just call just to talk to somebody because they didn't have anybody that understood what they were going through. Some people resorted to self-medicating on that end. We were working from home, so everything was remote at a certain point, I believe the beginning of April. So we didn't have face-to-face contact with them, but we were able to use video contact through WebEx. So we made that clear with them, and some of them were, if they had the technology to do it, we did it with them.
Great. So I'm just going to kind of throw a few questions out at both of you, and you can take turns, or one could take it. But share with us some steps that your agency had taken to help you continue to be able to do your work in the community corrections.
Well, in regards to Harris County Juvenile Probation, they have allowed us to kind of do a split in how we work. Field probation specifically now works in the office once a week. It has allowed us to get back to our actual physical files, which is sometimes important. Of course, we do have those electronic files, but I know some of us don't have the same access from our home computers to that intranet system. So being able to have access to the office at least once a week has been very helpful. The other 4 days we are at home, though, working from home. They've also allowed us for our high level or our high risk cases to actually go into the field and do what we call curbside / drive-by home visits once a week for them, or as needed at this point, because many of our caseloads have really dropped immensely due to them, just kids doing well, terming off of probation and getting out of placement. So it's allowed us the flexibility to go into the field and actually lay our eyes on our kids. Now, with that curbside contact, that's exactly what it is. We are not going into the homes at all. We're simply scheduling that appointment via phone like we would, but once we arrive to the home, we're pulling into the yard or the parking lot. We're remaining in our cars with masks on and asking that the parent, the guardian, and the youth come out, and we just conduct a conversation with them standing outside of the car about 6 feet or more away from the car and just doing our check-in. And so with that, I think the department, that has been very helpful. And I think it was just very innovative on their part to incorporate that flexibility for the officers, because as field officers, our work is primarily done in the field. So it can be challenging when we're restricted to just being at our home. So that department has been very supportive and very good at just, looking at alternative solutions to kind of combat this COVID-19.
Sounds good. So Veronica, same question. Things that your agency put in place that helped you, and were you able to work remotely as well?
Yes. Initially, when we started getting the COVID cases and the clusters, they had offered any staff that have compromised immune system or caring for somebody with compromised immune system to bring in a doctor's note so they can work remotely, because only our pre-sentence investigators were working. They were telecommuting, teleworking. In that position, but our field officers and mostly our family court officers as well was field officers in the office as well. So they made that accommodation for us for those individuals. And then when we went remote, they put in the state oversight agency modified their supervision requirements for us. They didn't lower them or lessen them. They adapted them so we can do more electronic communications to keep the individuals safe and then the officers safe as well. The department and the county also did a lot of mental health outreach and resources. So a lot of individuals in our department was sharing a lot of resources on how to get people food, how to get people unemployment. We had the stimulus package going on, so how to help the individuals apply for that. So we did a lot of focus on getting people resources in the time of need, because a lot of people were laid off. A lot of our individuals work these jobs that were considered non-essential,
Right.
and then they got shut down, so they had to work from home. So they were going through similar circumstances that we were going through with the whole transition and the chaos and confusion of this COVID pandemic.
Yeah. So as you guys or ladies, as we began to work this way remotely, was there more oversight by management? Did you feel like you were having to double document stuff, so to speak, to justify your time at home? Did you feel like there was this not oppression, but this oversight that wouldn't necessarily happen if you were sitting in the office? Or was it more of, we see you doing the work, we're following the case management, and you're able to really move freely and be productive as you needed to be?
There was a little more oversight in regards to, we've implemented a work from home law that we do have to submit weekly. But honestly, administration doesn't place a huge emphasis on it. We definitely do have to submit it weekly, but how we document on it and so forth, they just ask that our data entry is actually reflected and correlates with what we put on the time log. And so, initially, I think the agency was kind of freaking out a little bit, because that was new to all of us. We've never had to log what we do. And so I think everyone was freaking out a little bit. But as we've kind of gotten into this routine of things, no one even complains about it anymore. It's like second nature. You do it every week. And best practice for me has been just doing it as I go, because we do a lot. So it's hard to kind of keep up and reflect on what you've done. And if you don't do it as you go, now you have to go back into the system like, okay, what day did I put this in? What day did I do that? But like I said, initially, of course, change is hard, but we've all gotten into it, and it's not even a big thing anymore.
And Veronica, for you folks?
Our commissioner had given a directive to staff, make sure you're very supportive of everybody in this surreal time, and how people interpreted that and did those duties. It was different for a lot of the supervisors and officers. Some had to check in via phone every day with their supervisors. Some had to check in, by email or text. Some didn't even hear from their supervisor unless they called them directly. So there was a variation on what the expectation of the support meant. We also, some of our officers, took a while for them to get computer equipment and things to start working remotely. So there was a lag. So could you imagine not being able to do your work every day, and then all of a sudden you get your computer equipment and then you got to catch up? That was pretty stressful for some officers that had to experience that as well. They tried to put in a lot of sports, but we didn't do telesupervision. This is all new to us. Some of the officers were loving it to be at home. Some weren't, because like you were field officers and we want to be out there and responsive and preventative, not reactive and wait till something happen.
Right. So we kind of touched on the management piece of it. So share with your experience the communication from the leadership in your department. Was it helpful? Was it non-existent? Did you feel like you got just enough? Was it very supportive? And I'm really just curious as well. The secondary part is, did anyone just reach out to you just to check on you as a person, not necessarily as an employee?
I personally have had a very good experience. My administrator is great. Our deputies have been great at communicating. We get correspondence often from the top all the way to the bottom. Emails, sometimes too many to read. So they are communicating a lot. As far as in-house, we're broken to what we call community unit probation service units, and I'm in CUPS 8. Each unit is still conducting those monthly meetings with their administrators. So our administrators are still going to managers meetings via Zoom and then reporting back to their CUPS units staff what has taken place, what changes have taken place, whether it be policy or protocol. And we're still doing those once a month via Zoom. And we're still also going through training. So we're still doing our trainings. There's certain trainings they will allow us to come into the office for, because they understand that the access here is just a little better than home. But the management honestly has been great. There is nothing that happens in Harris County Juvenile Probation that I am not abreast on. I know what the changes are. I know exactly what the expectation is. So honestly, I have no complaints. And so we've been fortunate with that.
It's great. Veronica, has that been your experience as well?
I think my personal experience was quite different. If I heard from my supervisor, it was because she called or she needed something, or I had an issue. There felt like we're in these units, and it just didn't feel like we were close enough. And then I heard from other units, their supervisors were hosting weekly web meetings and Zooms and WebEx to just stay connected with their staff. Some staff liked that, and some staff was like, "Oh, I wish I was like you, where you're not hearing anything." But when you're used to going to the office and speaking to people and interacting with others, and then all of a sudden you're just like left remotely in the middle of nowhere, basically, to do your job, and then nobody reaching out. I know I heard that from a lot of officers, that nobody was reaching out and they were struggling, coping, doing certain things. So we made it a point to check in on each other. And I think from the officer perspective, that worked pretty well for some people. Some of the supervisors did check on their staff and offer support. I know one of my assistant commissioners, we just called each other just to check on each other, to see how things were going. I thought that was kind of lacking in this whole thing as we transition. But like I said, the commissioner had said we need to be supportive during this surreal time, and how people did that and interpreted it was totally different. And I don't think there was any oversight on everybody's piece on how are you taking care of each other and things like that.
Wow. Okay. Yeah. So it's a lot of different perspectives, and I'm sure that was kind of the thing across our departments nationwide is just a big variance on what was happening. And I know here we had to get a little bit creative, and at one point we had a staff meeting. We all have mobile radios, and so we literally just did it over the radio because we had no way of communicating at that point, just to make sure everybody could hear the same information at one time. So, sometimes it's just that. On behalf of management, not sure how to pull that off to get the communication out so we don't drown folks in email. So, but it is important that we reach out to our folks. So here we are, we're in COVID, you're learning to work remotely, and we're trying to do televisits, and all these things are going on. So what new barriers do you feel like were created that weren't there before due to COVID-19?
Some new barriers. I would say for this population that I'm working with, the newest barrier is that we're not in school. For a lot of the kids in juvenile probation, school is kind of like a safe haven for them, right? It's an escape. So I've noticed that kind of really knowing what's going on at home, that has become a barrier. The communication, of course, you're on the phone, you're FaceTiming, but they can kind of present whatever they want to you over a FaceTime or over a phone call. A lot of times with kids, being face to face is better because you can read body language. You can look for like visible marking, just their energy in general. So that's a huge barrier for myself personally, because I'm doing everything over the phone. And when I was in the school, I was seeing my kids. So even if they said they were having a good day, I could tell if they weren't having a good day. And knowing the dynamics of a lot of their homes, the family setting, it can become worrisome because they're telling you everything's okay. Mom, dad's telling you everything's going well, but that can't possibly be true because it wasn't going well before COVID, and COVID only has added and compounded stressors, stress factors and risk factors. So I have seen the domestic violence, and then like a lot of communication breakdowns amongst my family, households, and structures since the COVID. So I would say communication that's become a big barrier, especially going from seeing my kids every day, talking to them every day, being able to check in with them physically every day, and now not being able to do so. So it has made it a little challenging to make sure that they're getting the proper services that they need to, get through this time. But we're just doing the best that we can.
Sorry, I didn't unmute there. Veronica, what new barriers that you folks may have seen?
Well, some of it was the technology lag with people not being able to stay up to date with the technology, whether it was staff or the individuals we supervise. Could you imagine having to refer somebody and have them sign a release, and you're all remote, and then you're trying to teach them how to sign these documents? Okay, what device are you on? Let's walk through this. So that was one of the barriers of having an expectation that, both your staff and your individuals can do technology. And then now they're emailing and attaching documents and stuff. So you got to teach them about that. And we also got new software in our computer, like the Windows update or whatever. And some people didn't know how to use new Windows. And they were trying to figure out stuff, and they're trying to do this all remotely. So we don't have access. Like, we do have access by calling the IT department, but they were so inundated. The other thing is just the services, trying to connect people to services. Some service agencies weren't accepting new people. If you had to refer somebody for a detox, they had at one point get a COVID testing. There was one point where we couldn't even move people from treatment facilities because of this New York on pause order. They said we're not moving people around until after, just stay in place. So like one of my probationers. He was in a facility for like 6 months, and he was supposed to be discharged to a halfway house, and he just got freaked out by this whole COVID thing, and he decides he's gonna leave. And he's like, well, the courts are closed, so what can you do to me? And I was like, it's not what can I do, where else are you gonna go that's gonna be safe during this time? He's like, a hotel room. And I was like, and you think that's gonna be safer than a facility that put all these places, these cleaning procedures in place and safety procedures? So that was some of the barriers with dealing with some of this.
Okay, I have a little barrier myself, learning how to get the mute off. So we have a question from our attendees, and they also mentioned about not having the laptop in time and having to go back and do the work a second time, so to speak. The question is, how do you feel, or what maybe would be a procedure when you have to go to an apartment building to see folks? How does that change? Because for residents, that's simple, but going into an apartment building, how does that affect your work?
Well, for me, majority of my youth do reside in apartments. So it's the same for the most part because I was already doing it. It really didn't disrupt anything. I pretty much have gate codes for all of the apartments that my youth stay in. And now with COVID, I noticed a lot of those complexes just leave the gates open. I guess to reduce people touching the keys and the codes and stuff like that, putting in those different numbers. They just keep the gates open. So that's made it a lot easier for me because I can just drive right on through. But I've only had one instance where I was doing a home visit and that family didn't have an operating phone. So I did actually have to get out of my car and go to the apartment door. However, once I got to the door and they came to the door, they still stepped outside the apartment and we socially distanced. We had our conversation and then I went on, about my way. And I made sure, of course, I had my mask on and so forth. But going to an apartment, for me personally, is just commonplace. That's what we do. A lot of our families live in apartments. That's just kind of a way of living down here. So it really didn't cause any issues.
Veronica, you have something to add to that?
We were told no contact, no field contact. So we didn't have to deal with that issue. I do know that other departments, because I was very involved with the union and other departments in my region, that some of them were doing field contacts like drive-bys. And I know Alicia and I talked about this before, just going by the offender's home and just seeing that that's where they're at, maybe their job. So some of them did that, or some of them did in the community. I know one of my probationers needed to complete a housing application, and his mental health case manager wasn't seeing him or anything. So one night I said, he lives across the street from the park, and I says, I'm going to meet you at the park so you can sign this so we can get you your housing application, because although we were all stay at home and stuff, people were still working and still had deadlines. So I didn't want this individual to miss his housing opportunity because nobody could get him to sign a document. The gentleman is in his 60s and he's a veteran. So that was very important, to make sure that was done. And there was no way to get that done in the way we proceeded with things for these individuals who were in need.
On a positive note, let me check my notes here. So have there been any barriers that maybe previously existed that you feel like the adaptations for COVID actually helped overcome some of those barriers that previously existed?
I think one of the major barriers working with the juveniles sometimes is parent engagement. A lot of times the kids, once they buy into it or you develop a relationship with them, you're good with the kids. But we understand that, of course, they're children. So we also have to have the buy-in of the parent and that support. Otherwise, the youth cannot be successful. So in the past, a large barrier was always maintaining that communication and involvement with the parent. But COVID has kind of forced the parents to become more involved. It's no way for them to escape it, especially with me being at the school. A lot of times it did kind of leave the parent out because a lot of my interaction with the youth was during the school day. And then, the parent may only get a phone call once a month as a check-in, or if they came to the school because something occurred. But I know a lot of my interaction primarily revolved around dealing directly with the youth being in the school. But now that they're not in the school, I definitely communicate more with my parents that were hard to get in contact with before. They definitely have allowed themselves to be more flexible and open, and they're more receptive to the services and the help that I can provide, even for them as adults in their household as a whole, versus, just seeing it as my child's on probation. It's not about me. This is theirs. I'm gonna let them handle their business. I see them being a little more supportive, a little more engaged, and communicating better.
Well, that's great. Having them more involved, certainly, I'm sure it helps you in your job and in your role, obviously, and it helps the totally lost my frame of thought. It helps the cases, it helps your youth do better to have their parents involved. Veronica?
I have to agree with Alicia that the service providers and the families were a little more open to speaking to us and communicating. It was easier to get in contact with the treatment individuals, even though they were working remotely. They gave us their cell phone numbers, or now we could do emails with them. So that helped, and it obviously helped because the requirements for our contacts had changed and increased in certain ways for collateral contacts. So that helped us make those requirements for our supervision levels. The other thing is going to open more opportunity for people to do electronic and get technology savvy with everything. Our courts went virtual, so they were having virtual court, to have access to the court. So that was helpful. And I think moving forward, that might be something that hopefully the court will adopt. And as for the officers, more became open to text messaging with their individuals or the treatment providers or family members, or even doing WebEx meetings. I know when I suspected somebody who was drinking or doing something wrong, I would just, and even if they were doing everything right, just to say, hey, how you doing? I would send them a WebEx link like within 5 minutes and say, we're going to meet now, like a surprise report, just to say, hey, we're still here for you, or hey, we're here, you're still on probation just because we changed the way you're reporting. So that was interesting.
So you touched on the contacts. And I know earlier in our conversation the other day, we got to talk a little bit. Alicia, specifically, you mentioned that, we all look at risk, needs, and responsibility to those things. Mm-hmm. How has COVID affected the way we look at risk versus need? And has that changed the way we're supervising cases due to the COVID?
I believe that definitely has changed here in Harris County. We have definitely moved more in the direction of need. I think need, though, with juveniles is always at the top of our priority because we understand that they're children, that they're not adults. So the need is always really great when you're dealing with young people. But I have seen that the focus shift primarily to need. So although we are reviewing case plans once a month and regularly, I personally have been putting more emphasis on services. Right? What do you guys need right now? What's going on in the household? What is lacking? What could make this transition? What could make this process and this time easier for you? And based on those responses that I'm getting from my family, just pushing the services. You think you guys need better communication? Well, let me get the therapist in place, so that you can start those sessions. You think you need assistance with the parenting aspect? Let me get some multi-systematic therapy in place. You're having issues navigating the school online curriculum with your child, because that's real for all of us with kids, even myself. Let me get the educational specialists in place so that you have these resources, you have these advocates to help you navigate this new time of COVID and don't get frustrated and discouraged. And so I definitely see need at the top of our county's priority dealing with our youth. Now, risk, of course, is still something we have to take into consideration. So like I said, for those high risk offenders, we are going to see them once a month. once a week, should I say, just to drive by. So we are checking in. But I know with all of my kids, I pretty much talk to my kids weekly, all of them, whether they're low, medium, or high. I'm speaking to them more often just to maintain that connection. So yeah, I would say need is on the top of the priority list, but we are not forgetting about risk, because we do know those risk factors still exist.
Sure. Veronica, before we jump over to you, have you found some of your lower risk folks now being in more high need, that you're having to do more referrals services for even the low risk folks during this time, Alicia?
No, actually, I haven't. What's funny is with juveniles, unfortunately, I see a lot of juveniles have more issues while they're in school. So for me, traditionally, I would see a lot of new referrals come from school. So a lot of the referrals will be school initiated referrals. So it wasn't so much that they were getting in trouble or creating new referrals because of stuff they were doing in the community, but things that were happening while they were at school that would then turn into those misdemeanors or those felony level charges. So with the youth not actually physically being in school, it has kind of been a blessing in disguise for my population, because I don't see them picking up those new charges, those new referrals and stuff as much as I did when they were in school.
Wow. Okay. Yeah. Veronica?
I think that the focus was on needs. I know personally with my individuals, it was on needs because they needed services. We just changed the way they have their services implemented and gave them new ways to start calling in or doing remote services, telehealth, that sort of thing. A lot of them lost their jobs, or their families lost their jobs. So trying to link them up with unemployment, and also Department of Social Services, food stamps, Medicaid, that sort of thing, just so they could transition into this New York on pause thing where they could be supportive and stay at home and not feel like they have to make a poor choice and put them or their family members at risk for contracting COVID or committing a new crime because they need something. So that was tend to be my focus, make sure and I made open communication with them. What do you need? What's going to help you during this time? I know, like I said, the county Department of Mental Health, they were great for all county citizens. They knew the mental health was for just everybody was difficult. So they made sure that they did these links to certain peer groups, and they did open like meditation, things like that for people to really engage in the state. I had a collaborative effort with Headspace. So we offered that. I gave that information to the people that I was supervising, and so did other officers, just to help them cope. The risk was still there, and that needed to be addressed as it came up, because you had people overdosing. And not one of my individuals wound up getting quarantined for 2 weeks, and he was on MAT treatment, so medical assisted treatment. How do you get somebody, make sure for 2 weeks that they get their methadone and that they take it like they're supposed to? These are all concerns that we've had as all officers with, dealing with our people and how to effectively make them successful on their supervision. And I think COVID and all of this compounded all that. And they were looking to us for help. And you had to be open to helping them in that way.
That's great. And you kind of touched on a question that we had from one of our attendees, from Hannah. And she was asking about, have we seen, or do you know that there's been have you noticed a rise in overdoses in the caseloads? They have average of about 100 offenders. And since March, 3 of those offenders died of an overdose. So in your departments, not just necessarily you specifically with your caseload, have you heard of or seen a rise in overdoses during this time?
I personally haven't had any overdoses, but I have seen a rise in just substance abuse amongst the juveniles. I think, idle time, they're going to find things to do. So no, they're not picking up new offenses or new referrals, but I have been doing a lot of referrals to the just substance abuse workshops, therapy, and I'm even working on a referral right now for residential treatment, because I have seen that usage kind of skyrocket in this COVID time.
Okay, so we'll shift gears just a little bit. So where do you see community supervision moving forward from here? What does the new normal look like for you and your agency and your new role?
I think here in our agency, I think the new probation, I really kind of see the agency adopting this virtual way of engaging for our low offenders. We already have our own a separate division that specifically just supervises our deferred youth, so our deferred adjudicated cases. I definitely can see the county adopting this method because with that, their emphasis is already kind of putting that distance between the youth and the criminal justice system, just to help reduce the recidivism because there are lower offenders. So I can definitely see them continuing more of the telecommunication, more of the Zooms and FaceTimes for check-in versus physically making the youth come into the office. So I just see a lot of this stuff becoming more permanent, not so much with my demographic because I actually supervise adjudicated youth, but I definitely can see it becoming more permanent with our deferred supervision cases.
And Veronica, what do you see as our new normal moving forward?
I think we're going to have to learn to be more flexible in our job duties and what's expected of us. As far as
You mean we all haven't been flexible enough already?
but because how many officers do the practice of come report between 2 and 4 on Tuesday afternoon, and the waiting room fills up with people, and it's just a revolving door. You're not going to be able to do that anymore.
Right.
And the people wait for hours or an hour to be seen, 45 minutes to be seen for their turn. So it's going to be a little more structured and organized, probably not a drop-in center in some of the departments that you hear about. You have reporting day, reporting hours. And the offenders are going to have to be more in tune with the schedule. So it might help them with responsibility and stuff when they know they have to be at a certain place, because this is going to happen not only in our profession, but in the medical field when you go to a doctor's appointment and stuff. Thank God we're not going to have to wait an hour to see your doctor anymore.
Right.
So it's a little more courteous of people's time and respectful. So I think that's where you might be headed to. I think a lot of departments might be willing to let more people work remotely. I know when we were doing our technology committee meeting, I was surprised to see more people were working remotely before COVID. I didn't think that was a trend in probation to allow people to work more remotely, because in my experience, it was like, oh, you're on vacation while you're at home working. No, I'm not. I'm getting phone calls at 11 o'clock at night. So that was always a, something, and you took those calls, because if your offender didn't get in contact with you, some of them played that game of, I'm going to wait till 7 o'clock to call you to report when I know you're not going to answer the phone. Well, guess what? I answered the phone.
Right.
Because I knew if I didn't make that connection when they ran the stats for my cases, who was going to be held accountable? Me as the officer that didn't make that count. They were going to say, you should have done this. We need you to make that contact. So you were very flexible. I know I was, in getting that done.
That sounds good, and that sounds like a win-win, right? I mean, it eliminates. I know I've seen it for 20 years that, you're trying to make that contact and they always show up on the day that they know you're not at the office so that they can say they showed up. So, if we're limiting the number of folks coming into offices and they know that we can eliminate at least one of the reporting games that they try to play with us, that they're trying to stay in compliance. So we're running a little low here. I just wanted to ask 2 questions. Let's start first with, for leadership and management that are listening, right? As line officers, just take a moment. What do you want to hear from them? What do you feel like you need to hear from them? What are you looking for from them that will help you, support you, and propel us forward as we go? Veronica, you can start this time.
I think being supportive of your staff, knowing and trusting your staff, yes, you're going to have staff that doesn't live up to your expectations, but sometimes the expectations that are put on us between these mandates and management are unrealistic given the time frame. Like, I might have been flexible taking calls at 7 o'clock at night because it worked for me to get my job done, but for somebody else, 7 o'clock at night, they're like, I'm not being paid for this. I don't work for free. You have to respect people in whatever belief they have and however they do the job done. It doesn't make one officer better officer at their job. One is more flexible maybe than the other. You also have to have good communication. Departments who did not have good communication or leadership before this, they probably felt the officers probably felt a lot more of lack of leadership and lack of communication during COVID.
Alicia?
Okay, yeah. Look, I'm having difficulty taking my stuff off of mute now. Okay, was messing with the polls. Okay, so as far as leadership and community, honestly, I know it's so funny, and I like that we have the different perspectives, right? Because I'm looking in the chat and I'm looking at the dialogue there, and then also hearing Veronica and what she experienced. It's like, oh my gosh, my experience has been so different, right? So the communication leadership it's been, I have no complaints, like, you know, and then the ones I had, once I started reading these questions and these statements in the chat, I'm like, I don't even have those anymore, right? It makes you kind of see how blessed you are, and how, you know, much of an issue stuff is or isn't. But the leadership has been great. I would just like to see my leadership continue in this direction. They've been flexible in a way in which I had not experienced, you know, coming into the agency in 2014 with corrections in general and criminal justice. I feel like there's this mentality that things are a certain way and have to be a certain way in order for us to be productive in our jobs. But they have definitely stepped out of the box and allowed themselves to be adaptable and flexible and empathetic to, you know, us as their staff. And they've worked with us well. Like I said, I have absolutely no complaints. Like today, I'm in my office. It's not my duty day in my office, but because I had to do this, they're like, sure, you can go to your office. So I haven't had any issues. Administration has been great. I would just like to see them continue in this direction with their support. And like I said, I know it definitely sounds different from a lot of people. I hate to hear that they're not having as great of experiences, but I'm hopeful that with this panel, you know, it will help enlighten some people. They can see what other people are doing around the world and maybe start to incorporate some of that into their policy and procedure, and that it will make some of these other people's jobs a lot easier and this transition better for them.
So Veronica, while we have several folks that are joining us here, we appreciate everyone joining in on this session. What would you tell your fellow line officers going forward? What would be something that you would like to share or say with fellow line officers?
We are probably our own worst enemy because we don't speak up enough to our supervisors and express our needs. As probation officers, we're fixers. So we just handle the problem that comes through. We don't really complain. We'll complain to our coworkers and stuff. But if you really want to be about change and how to move forward and keep people safe, yourself and family safe, we have to speak up and advocate for ourselves. We advocate for probationers all the time, victims all the time. We do not advocate for ourselves. I think we need to be a little more supportive of each other. We all play a different role in whatever your assignment is in your department, and one assignment's not more prestigious than the other. You know, oftentimes people say, oh, you're just a pre-sentence investigation or a pre-sentence writer, and you're the field officer, you get to work in the school and not come to, we all do a very stressful job. We need to make sure we take care of ourselves. We have to take care of each other so we can take care of the people that we're supervising. And sometimes some places have union representation, and I hear from a lot of officers that their unions are not very supportive, or they're very supportive. I know down south, you guys are like FOP unions down there. So they're very supportive and vocal of the needs of probation officers. So I think we need to be the squeaky wheel that really advocates for what we do. and why we do it and the successes we have, whether, we're in the business of, lowering recidivism and not promoting recidivism.
That's great. Alicia, what would you tell your fellow line officers?
I totally agree with Veronica. Like she said, just speaking up, not being afraid to go to your administrator. I think part of that, though, is just developing healthy communication and healthy relationships amongst your administration as well as your team that you work with. Just respecting everyone's position and role. And I know a cool thing we do here, I haven't had to use it much, but we do have this thing called Ask the Chief. And you can go to our intranet page, and any questions, any concerns you have, you're free to just go and shoot your question directly to the chief, and he'll respond back to them. So I thought that was kind of cool of our agency to do that. And that was something that existed even before COVID, but I'm sure it's being used a lot more now that we're in this era. But I think keeping those open communication lines is very important too, letting people know that their concerns are welcome and that they are being heard. And although we can't always get our way, but just sometimes someone listening and hearing you is enough.
Yeah, that's great. That's great. So last question before we open it up to some question and answers. If you had a magic wand, what would you change other than no COVID? What would you change if you had a magic wand? Veronica?
I think it would be supporting each other to move forward, and then how to make this work. Because going forward, I mean, you're going to have COVID, you're going to have other things that come up. So how to be adaptable and effective at the same time, but also support each other in all these roles. Because, management answers to one person, or, they're appointing authority, and the officers answer to their supervisors. Supervisors are middlemen between the two. So I think just being supportive, recognizing everybody's roles and responsibilities so you can understand that, so we can move forward and adapt to keep everybody safe.
If I had a wand, oh my gosh, there's so many things I want to do, which is why I'm still in school. But in the immediate, I've been on a board just really working towards removing the implicit bias that exists in our schools. Like I said, many of our referrals for Harris County juvenile probation come directly from a plethora of school districts here. And so that's kind of disheartening, because that's the place where I say a lot of kids go for refuge. That's a home away from home. That's like their own little space. And so to encounter those different obstacles that I see a lot of my population encountering when they go to school is really sad and unfortunate, because we're supposed to be uplifting and like planting seeds in kids in school. It shouldn't be a place where they get filtered into my supervision. So just removing the implicit bias that exists in the school system and allowing them to better be able to interact and provide services for the youth and the demographic that we serve.
That's great. So just posted in the chat section where there's some information that was sent out already previously, where you can go and give written comments. They're collecting information for a report on the effect of COVID. And so that's the information there that you may need. Lastly, Veronica and Alicia, are there anything else that you would like to add or share with our folks that we have not touched on yet?
The return to work plans. Make sure that you're active in your return to work plans, because if you're not, you're going to wind up complaining about safety and everybody else's safety. So be very vocal. I know when I was working, my labor management team that I was working with, we posed a whole list of 18, 20 questions. We sent it to the union. So we knew when we were going back to work what the new normal was going to be for everybody and what the expectation was. Whether what they did with that information and how they worked with the county because it wasn't just our department, we just expressed these concerns, and the union said everybody has the same concerns. So just being vocal, because if you don't have any solutions to returning to work, management's gonna, and the county executives, and they're all gonna be looking for how do we make you all safe? They don't know our everyday comings and goings and what we do. So how do they know that, okay, we all show up at the same time for reporting? They don't know that. So if you tell them, okay, we can't do that because it's not social distance, this is our solution to get our job done. But then again, management has to support their staff and trust their staff that they want to do the job that they chose to do. We all were called to do this job for a reason.
Right.
I agree. Like, I agree with her wholeheartedly. So mostly just knowing that, you know, I just want to offer encouragement to everybody. This is a challenging job. This is not just a job. It is definitely a ministry. So anyone doing it, I would hope feels like they're here because they have a sense of purpose in this work. So I just want to encourage everyone to just stay flexible, stay adaptable, understand that even though we have administrators and leaders, they don't know everything. They're trying to navigate this thing just like we are. So like she said, if you have concerns, you have questions, be a part of that return to work plan. That's going to be very important and for your mental sanity, you know, so that you don't become disgruntled and upset, because we got a long journey ahead of us. This is not the end. We're in the beginning phases of this, and being flexible is really important. But I just say everyone stay encouraged, continue the great work that you're doing. And I'm excited to see when we do these next roundtables, how we've evolved in probation as a whole.
And if I could just add, because I know a lot of officers with the deaths going on, whether it's personal with the people that you work with, your colleagues, because of COVID, the increase in substance abuse and overdose, yes, it does take a toll on people that do this work. You need to speak up about it and find some support, because, you know, for some people, it's just the job. Don't take the job home. You know, we took the job home because we're working from home. So, you know, you're sitting there at night, right, and then all of a sudden you get a call that, you know, the police found somebody, you know, overdosed, you know, who's their next of kin to call? What do? We found your name in their pocket, so we called you. I mean, I don't know if anybody's gotten a death notification. I mean, in probation, I'm sure we all have. It's hard, we're human beings, and take that emotion out of it when you know somebody for 3-4 years or 1 year, and you know their whole family. Okay, there's a human piece of you that says, I have to relay this information, or I'm like, oh my God, like this happened to that person, you know. And the other thing is with the opioid stuff, I know somebody had mentioned it, we stopped doing drug testing, you know, so how do you monitor somebody's sobriety? And I know talking to an officer, they had brought up, you know, they started implementing patch testing, and then they would have to come in and get their patch read to make sure that they were maintaining sobriety because they had such overdose rates in their area. We know that's a national pandemic, and this COVID is a global pandemic. So until the world gets it under control, we're going to be dealing with it.
Yes.
Yes. So does your particular office, I know in our office, each office has a person that's an EAP person that helps. They're there for support, peer support for the other officers when they're struggling. Do you have those kind of folks that are assigned in your office that have had training, and not necessarily as counselors to other staff, but referrals where to send other staff as they're struggling? Maybe someone in their family, like you said, has passed of COVID. Maybe someone has COVID. Maybe they've had it themselves or have it. And it does take a toll mentally, sometimes well more than physically, just the quarantining and all the stuff that's going on. And also for families who, I know personally, my wife didn't want to be a homeschool mom, but that's where she's at now. So do you guys have folks like that in your department that are assigned to those kind of tasks?
I am not aware of us having that, but I think that's a really great idea. One that, like you said, I will take and bring to my personnel and administrators, because I think that's really needed. I mean, not just because of COVID, but in general, the work we do can be draining, right? We deal with a lot. We deal with a lot of hurt, a lot of loss. So yeah, I think that's a great idea. So that's something I definitely would propose.
Yeah,
we haven't. The department county I worked for, we had an EAP program. So you could be referred, do self-referral, but because we're law enforcement officers, people were like, no, we don't want to deal with EAP. Thankfully, our law enforcement officers in the county, they started something called Westchester Blue. that was great. A couple of years ago, they started that, and that's all about officer wellness and assisting officers in a confidential manner. There's also resources like Code One Wellness, which is out of Kansas, that provides free resources to law enforcement. And Acadia Healthcare partnered with the FBI National Academy for their officer resiliency. So they have a law enforcement liaison. So, some officers admitted to drinking more during COVID, and sometimes it could be a problem for them. So where could they go for peer support? There was a lot of law enforcement agencies that had online peer support groups available, like every Monday and Thursday night. You could call it.
Yeah, and so I'm looking at Terrence's comment on the chat. Vicky, certainly the magic wand is advanced technology for all, but not just advanced technology. Finding the right fit for your agency is going to be important for your leadership. So I would encourage leadership. Don't just reach out and grab it the first thing coming. Take time to vet what will actually fit for your agency, and consider your line officer. If you're taking in some programs, and I know we had to do stuff at a rush, but please involve your line officers the day-to-day. I know we all did the job. I've been doing the job 20 years. But if you're not still out there on the line every day, we've put so many policy changes in place that, the job is different. It really is. The core of it is not. It's still about caring and taking care of folks. But the everyday, what we have to do has changed. So you really want to involve your line officers to get a lot of really good input, and that's going to help it to be successful as you transition to those things. See, Pamela has her agency has a peer team, trauma support team, and that's great. If you need to speak to somebody, please reach out. This is stressful times. We're all going through things, and just be aware of those folks around that you're around all the time. I'll admit it. I don't think one of my staff came in the other day and advised me of some stuff going on the home front, and I was just clueless. And so when he left, he got support and help. But I really sat in my office like, how did I not notice? And so I just want to encourage officers, management, leadership, be watching those folks around you. Contact the folks you work with. As Terrence said, our line officers are our first line of defense. Those are the folks where the rubber meets the road. They're carrying most secondary trauma when overdoses happen, when people fail, and they've worked so hard with them. So we really got to take care of our line staff, folks. We got to take care of each other. As I said when we opened up, the family of community corrections, we do it all just a little bit differently. But as Alicia said, it is a calling. It's something. If this is for you, you know what it's about, and that satisfaction of getting that person and watching their life get on track is so rewarding. It doesn't happen enough. But when they do, it's so rewarding for us. So I just want to encourage all of you, keep doing what you're doing. You're doing a great job. We're adapting. We're overcoming. It's, as Veronica said, that's what we do. We've always adapted. We're fixers. We'll figure out a way to fix it. If it means sneaking to the park to get a signature and getting somebody in housing, we do what it takes to do to serve the folks that we serve. And I'm just proud to be a part of this community corrections family nationwide of what we do. Alicia and Veronica, we just have a couple of moments. So do you have one last word?
I just want to thank you for allowing me to be a part of this. This was really great. It's really informative. I'm over here taking notes while we're doing the panel because I see some things coming through the chat that I think are cool and great, and that our department could definitely probably look into having. It would be an asset. So I love this. This is good.
And I just want to thank APPA for continuing these roundtables.
Okay, now we've all done it.
Okay. I just want to thank APPA for continuing to do these roundtable discussions for line officers. I know when I was one of our committee meetings a couple times with the technology committee, I was having rough days. I was just adapting, not even adapting, but taking on the job as far as what we're seeing, and people weren't realizing it because we're remote and you're not going to the office every day. So being there for your staff, and then the people on the technology committee were like, "Oh, we don't even realize that's what line officers are facing." So the APPA thought this would be a great idea to try and relay that information and find valid solutions for, what we're going through, and to really validate our feelings and our emotions during this time, because it's a rough time for everybody, but it's also, we've always experienced this stuff. COVID just compounded it all.
That's great. And yes, I want to lastly close with saying thank you, APPA, for giving us the opportunity to hear real truth, the hard work of our line officers, to hear what was good, what was bad, what's been productive, what's not been productive. I love the opportunity to have them be able to tell leadership what they needed. So hopefully some leaders are listening and saying, maybe there's a piece that you've been missing. And really just thank APPA for always empowering and educating and getting us all together in these forums as a conference, on the virtual. They're doing it now, like always supplying good tools and resources for our agencies and our field of work. So everyone have a great day. We enjoyed having you with us, and we look forward to seeing you again at future events.